Guys, hello and welcome to my YouTube channel. I hope that you are doing absolutely fine and your preparation for your NeetPg or INICET or USMLE is going good. So in this video, I just want to convey how important is the U world. I won't talk and I won't show my face, but I will just show you the book and how to use it actually. So guys, let's say I have opened this musculoskeletal section of my first aid, and yes, let's go on and let's see what we got in this. Now you tell me the anterior drawer sign, posterior drawer sign, abnormal passive adduction, abnormal passive abduction, McMurray test. Does it belong to anatomy or does it belong to orthopedics? Obviously it belongs to orthopedics. Okay, so don't say that first aid is a book that is for first year or second year. It is not like that. Now just see at this thing. Okay, this is lumbosacral radiculopathy. You tell me, in which year do you study lumbosacral radiculopathy? Do you study it in first year or do you study it in final year orthopedics or neurology? Obviously, see how beautifully you have that L3 L4 L4 L5 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 S1 lumboradiculopathy, like which nerve root is affected and how the symptoms are gonna be. Okay, now this is something just the action potential and how the sarcomere behaves. Okay, what is the A band does, what does the I band does, what does the H band does. We confuse in reading these things so much, but these things are written so nicely over here that this is what you just want to remember for your exam. Now just see this flow chart. Okay, you might have seen this thing in your I guess pharmacology. Okay, this is here. Okay, now let's move forward. Now bone formation, it is endochondral bone formation and membranous ossification. You study this thing in your embryology, but it is written over here. You see the muscle spindle reflexes and the Golgi tendon reflexes. Now I'll show you one thing. Okay, I'll show you one thing. This is the unhappy triad. You study this in orthopedics. Prepatellar bursitis, you study in orthopedics. Becker cyst, see the MRI pictures. Okay, see the MRI pictures. And if you study it properly, obviously you are gonna see what is the ACL. And in the exam, in the radiology section, maybe you get a question like just label the ACL, and if you study it properly, you will get to know what is ACL. Now tell me, plantar fasciitis, medial tibial stress syndrome, compartment syndrome, okay, ganglionic cyst or leg Calfeus-Perthes disease, Osgood-Schlatter disease, patellofemoral syndrome, all these things, they are just the orthopedics things. And don't say ever that this book is for first year second year. First year second year guy cannot understand this thing. Okay, so much is written over here, like so much. If you study it properly, just go to the exam without reading anything else. See how beautifully we have the flow charts. Okay, all those things which we always confuse, like what are the, okay, I'll show you, I'll just move it. What are the what are the various values, okay, like serum calcium phosphate, ALP, PTH in various kind of bone lesions. Okay, and it is so beautifully written over here, like so beautifully written over here. Okay, osteoarthritis, rheumatoid arthritis, gout, okay, calcium pyrophosphate deposition disease. Now you tell me, seronegative spondyloarthropathies, do you study these in second year or do you study them in final year? Okay, obviously in final year. Okay, just look at this, just look at how bamboo spine is given over here. Just look at how that psoriatic arthritis is given over here. Obviously, now look at this polymyositis, dermatomyositis. Just tell me which second year guy knows about this polymyositis, dermatomyositis, and what are the specific antibodies, what are the non-specific antibodies. Do the first year second year people just know the meaning of specific and non-specific? Then don't say ever, don't say it is a book for first year and second year. It is a book for everyone. Okay, now see the dermatology section. Okay, maybe you just get a question on what is the difference between rosacea and acne vulgaris, and you are done with the dermatology section. I am sure that in dermatology you will get one question from the blistering disorders, and all the blistering disorders, they are over here. Okay, like pemphigus vulgaris, bullous pemphigoid, dermatitis herpetiformis, everything is over here. Okay, just see the burns. Okay, now burns we read in surgery, and this is the whole classification. this book is so rightly made so so nicely made that it covers everything. Superficial burn, superficial partial thickness burn, and also I want to convey, like, this is the amount of material you want to know, you should know about USMLE step 1. Okay, just look at these TNF alpha inhibitors. Okay, all these gout drugs, they are just given. And neurology, just forget about neurology. It is so huge, it is so huge, it is so huge, it is so huge that you will just get lost in neurology. It is so huge. Let's just look at these movement disorders. Okay, all these confusing terms like essential tremor, intention tremor, resting tremor, oh, these are so nicely written. Just look at these dementias and neurodegenerative disorders. Okay, just look at the MRI of multiple sclerosis, these periventricular plaques. Okay, so this is what I want to convey, that please study first aid for USMLE, not for USMLE but for your NEET PG also, and it is going to make a huge change in your approach. Okay, thank you so much, and I'll keep posting videos like this.